We'll put 2 minutes on the clock and your time starts now. Michael Snyder, a 65-year-old man, presents to the general practice with complaints of recurrent heartburn and regurgitation of sour-tasting fluid into his mouth. He reports experiencing these symptoms after meals and when lying down. John has a history of smoking, consuming approximately half a pack of cigarettes per day for the last 40 years. He occasionally consumes alcohol. He has no significant past medical history and takes no regular medications. On examination, John appears well. His temperature is 36.8, blood pressure is 130/80, heart rate of 80 and regular, respiratory rate is 16, BMI is 29.3. The remainder of his examination is unremarkable. What is the most likely underlying diagnosis for Michael's symptoms based on the given information? Provide 4 appropriate responses. And time is up. Good to see some answers coming through. And, of course, some suggested answers for you. Common things are common. Again, they're not trying to trick you up. This is a very common presentation in general practice. So the key players are going to be gastroesophageal reflux disease, peptic ulcer disease, esophageal dysmotility, gastric outlet obstruction, hiatal hernia, and esophageal compression or mass or malignancy. That all be kind of grouped together for single answers. So, as you've got there, fantastic to see. And, gastric cancer would be coming into that malignancy bracket down the bottom there. And everything there is fantastic. There was a couple of articles I was reading up when putting these answers together. That just cautioned specifying H. pylori infection itself. Go back to what is the H. pylori causing in terms of peptic ulcer disease would be a much more specific answer for KFP. You would potentially get an answer, get a mark for specifying H. pylori, but they would rather put peptic ulcer, and then as part of the workup, you'd be specifying you'd be doing a urease breath test, for example. Hopefully that makes sense. Good. Pardon me. And again, we've got peptic ulcer, acute gastritis. Now, that would potentially be an answer, except for the fact that this specifies that it's recurrent heartburn and regurgitation. And so you probably wouldn't get a mark for that, given the stem's kind of hinting this is a more chronic, more ongoing kind of condition. But you are kind of right in that it hasn't actually specified a time frame. And so there might be a little bit of leeway if enough people were to all put that answer as well. But again, I think probably the safer option would be to specify something a bit more chronic. Excellent answers otherwise. And again, there, as you've got there, gastroesophageal reflux disease. Nail on the head. Well done. So let's move on to the next part of the question. We'll put 2 minutes on the clock and your time starts now. Michael is reluctant to undergo any testing and would prefer to try conservative management in the first instance. What non-pharmacological management would you recommend to Michael? List 5 non-pharmacological management actions. and time is up. Going to the answers then. We have elevation of head of the bed being worth 1 mark. These are all from RACGP and handy guidelines as well. Now that is, and this has been apparently in exams previously where that has been an accepted answer. There's actually very little evidence, though, to say that elevation of the head of bed is a dramatically successful therapy. But if someone's willing to try conservative management, it is still as part of the recommendations. Weight loss to BMI under 27 or healthy BMI range. Tracking and avoiding trigger foods, beverages, reducing fat intake, avoiding spatty. Wow. Spicy and acidic foods, eating smaller meals, all of those would kind of be grouped into one kind of one group and be worth 1 mark. Avoid lying down or exercising immediately after meals. Smoking cessation interventions, and that's, you'll see, worth 2 marks. That's a big ticket item for this kind of question. And limiting alcohol consumption as well. And seeing these answers coming through, some gold stars there. Absolutely nailed it. Very, very well done. And I think all of those things would be wonderful. Just be cautious with the do a food diary to identify, then avoid triggers of symptoms. That may veer slightly into overcoding territory, given you're specifying 2 things, one being tracking, one being avoiding. Probably a safer way to do that would be, say, food diary for avoidance of triggering foods. So it's saying the same thing essentially, but in a sneakier way. Sitting upright for at least 30 minutes after each meal. I think any clinician marking this would count that as avoiding lying down or exercising immediately after meals. Would definitely be worth a mark, and encouraging weight loss. Again, as you've got in there, the smoking cessation, refer to physiotherapist for exercise program, losing 5% body weight, fantastic. They may be kind of joined together, so I would just be a little bit more cautious in that one. Avoid lying down immediately after meals, beautiful, and avoid spicy meals. Which really sucks because I get a little bit of reflux myself and I love spicy food, so that one really, really hurts me. At a personal level. And again, avoid consumption of spicy foods. Oh, come on, guys, you're killing me. Reduce alcohol consumption, weight loss, sleep at an incline of 30 degrees. So fantastic. You've got the elevation of head, bed, and smoking cessation. Well done, well done. And more gold stars all around, guys. Absolutely nailed this question. Pardon me. Of course, there is a third part to this question, so we'll put another 2 minutes on the clock, and your time starts now. Michael follows your advice and his symptoms resolve. He returns, keen to address his smoking, and after discussion he agrees to commence varenicline Champix. What specific advice would you have on commencement? What 5 aspects do you discuss? Dosing is not required. All right, and time is up. Seeing some good answers coming through and through to the suggested answers here. So one of the key things is you have to commence this for 7 days before you stop smoking. And that's a very, very important feature to actually get a good effect from it. So because of that, you will be getting 2 marks if specifying. Now, this is one of those medications where we really caution about the mental health effects from it. And there is, it's common practice to advise caution when there's significant mental health disorder alongside. Now, several studies have shown that there is not an increased risk of neuropsychiatric events on patients taking Champix. However, there have been reports of suicide or new or worsening neuropsychiatric symptoms. And so because of that, it's hard to say whether there is an association there, thus the general caution in the medical community. So it's one of those things where the evidence isn't there, but it's made enough people nervous enough to say, look, it's worth having that chat in the first place. So you would get 1 mark for mentioning it, despite the lack of evidence. Just one of those things. Now, of course, monitoring for common side effects, and probably the big one most people are aware of with Champix is nausea, being the thing that often stops people from actually taking it in the long run. But you could also specify vomiting, dyspepsia, constipation, flatulence, abdominal pains, weight changes, taste disturbance. Of course, the abnormal dreams. I've had patients actually request to be put on Champix because they had such weird and wonderful dreams while taking it. To each their own, I guess, and insomnias or parasomnias as well. Taking with food can help reduce nausea as a part of management advice as well, and that's something that actually can dramatically change people's tolerance of it. Given the risk of sedation or dizziness for the first dose, they should be doing it at a time where they're not going to need to drive cars, operate machineries, or do anything dangerous. Dose reductions possible if nausea or other side effects are limiting its use, and success rates definitely increase if you're using it alongside nicotine replacement therapy. Now, once people come off from Champix, there is a period where cravings for nicotine or that withdrawal pattern actually increase, and so you can get high relapse rates following cessation, so reinforcing that when we come off of this, you need to be prepared for that and have all things in place. Smashing the answers there, very good. And yes, specifying the time frames, and that is 100% correct in that you need to complete at least 12 weeks, but potentially add more for full effect. So that would be something that I think would get you marks. Watch out for bizarre dreams as a side effect. Pardon me. Not the most scientific way to put it, but I think any examiner marking that would have a little chuckle and say, yep, you know exactly what you're talking about, and I think you'd be getting the full marks there as well. Quit date to which he agrees to, yep, so I can see here you've made a note. Where was it? Asking about Champix specifically or smoking cessation in general. So this is where, again, being really nitpicky about the question being asked. So asking about Champix, what specific advice would you have on commencement? Ties it into we're focusing in on the commencement of the Champix. What are things specific to that medication? But look, a fair question. I think if enough people kind of fell into that trap as well, they probably would be looking at rewording it for future use or accepting more broader answers. But yep, as you've got there. Oh, sorry. If we go back to, we've got that one. Here we are. So stop smoking after 1 week after starting Champix. Start using nicotine replacement. Fantastic. Pull up in 2 weeks. Yeah, look, I think you probably would get marks for specifying a follow-up plan as well, particularly when this is a medication that causes so many side effects. Referral to quit line would actually be part of a structured quit program. And I think if enough people answered that, you might actually pick up marks there as well. Avoid alcohol consumption, though, I think would be unlikely to give you marks. So just be a little bit careful. I do like even reducing as an endpoint is still good, and that's something we definitely should be reinforcing to patients, that even if you quote-unquote fail a quit program, taking those steps and going through that process makes you more and more likely to succeed with subsequent attempts. Now, would model answer 2 be potentially given 0 score since case stem says no past medical history? Now, this is a bit of a tricky one because they often say that they're not trying to trick you. All the information will be in the STEM. This is one of those situations where, because the implications are life-threatening and that things like mental health often aren't discussed, it would be something worth clarifying. And so I think you could argue either way. There have been lots of cases and questions where this exact kind of situation has happened, and one of the expected answers has been to acknowledge one of these major kind of side effects. If there's ever kind of risk of death or serious harm to a patient, even if it's kind of specifying, no medical history, I think it is worth actually reinforcing that you are taking that into consideration. But look, an excellent and very valid point, and a source of frustration for people taking the exam everywhere. Excellent.